Colposcopy Testing after an abnormal Pap test. This patient resource was adapted by the Society of Canadian Colposcopists, SCC, with the permission of the BC Colposcopy Program. This patient resource was made possible through the support of Merck Canada, Inc. The opinions expressed in this material are those of the authors and do not necessarily reflect the views of Merck Canada, Inc. No, an abnormal Pap test result does not mean that you have cancer. It means that the cells taken from your cervix do not appear normal. There are many causes of an abnormal Pap test, such as an HPV infection, inflammation, and precancerous cells. Abnormal Pap test results need further examination and testing. It is important for you to go to your follow-up appointments. Repeat Pap testing or a colposcopy exam with a specialist may be needed. Colposcopy is a way for doctors to use a special microscope called a colposcope to examine your cervix and vagina. The colposcope lets the doctor see any abnormal areas on the cervix or vagina. The doctor will take a biopsy, tissue sample, of any areas that look abnormal. Specially trained physicians, usually gynecologists, will complete your colposcopy exam. The colposcopy exam should only take 5 to 10 minutes to complete. The exam starts out like a Pap test. The doctor will place an instrument called a speculum into the vagina to see your cervix. A small amount of vinegar and/or iodine will be used to paint the cervix to help see any abnormal areas. The doctor will often take a biopsy, tissue sample, from the surface and/or the opening of the cervix for further testing. No, colposcopy is a safe procedure. It can also be performed safely during pregnancy, although biopsies are not always taken in pregnancy. You may have minor bleeding from the biopsy that is taken during a colposcopy. Examination of the cervix and vagina does not usually cause pain, but it is uncomfortable. During a biopsy, you may feel a brief pain, pinching sensation, or pelvic cramping, like period cramps. There are no activity restrictions following your colposcopy. If a biopsy is taken, there may be some spotting after your colposcopy. This bleeding should stop within 24 to 48 hours. A tampon is sometimes used to help stop any bleeding around the biopsy area or as protection from spotting. If a tampon is used, it is important that you remove it 2 to 4 hours later. The results from your first colposcopy will be available approximately 2 to 4 weeks after your visit. It is important you follow up and review your results. The colposcopy clinic will let you know whether you will get your results from your primary healthcare provider or from the clinic. A healthcare provider will explain the colposcopy results and discuss any next steps for exams or treatment. To see all the patient resources in this series, scan the QR code.